Hi, I'm Brian Cope. I'm with Primary Urology in Burlington, North Carolina. We're here with Ask the Doctor tonight to talk about kidney stones. If you don't remember anything else, water, water, water. 80% of all kidney stones come down to not getting enough water. If you go pee and the urine comes out yellow, you need more fluid. Lemon is the other thing. Lemon, lemonade, lemon in water, however you can get it in. Now that does not include flavored lemons, like the Country Time lemonades and things like that. You need real lemon. Lemon has a chemical in it called citrate. It's a cousin of vitamin C. Vitamin C in excess can actually hinder how the citrate works in the body. So too much vitamin C can be bad for kidney stones. But citrate in and of itself, it acts like a stone inhibitor. It keeps the crystals from sticking together, for lack of better terms, to keep the stones from growing into bigger stones. So the more lemon and water that you have really covers about 80% of all kidney stones. The other 20% then fall into metabolic sections. And basically the different metabolic aspects are oxalate problems. Oxalate problems are genetic. You're born with them most of the time. People with Crohn's disease, ulcerative colitis, short bowel syndrome related to surgery and other things don't absorb oxalates properly that can lead to kidney stones. But some people just have abnormal oxalate metabolism in their body. Oxalates, it's a chemical that's made in the liver that's put out in the gallbladder. It's basically the bile that the body uses to help break down fats into smaller particles so that the digestive enzymes can work on it. Sort of like what dishwashing liquid does in the sink. It breaks down the fat so that it doesn't feel greasy. This breaks down the fat so that the digestive enzymes can work on it. And so our body makes all the oxalates that we need. But here in the South, we tend to have lots of oxalates in our diets. Teas, colas, coffees, green leafy vegetables, nuts, seeds, rhubarb, chocolates, beets, peppers, cranberries, lots of different foods have high oxalates. And we like our greens, we like our spinach, we like our sweet tea, we like all the things that have high oxalates in it. So we get all the other oxalates in our diet in addition to what our body makes. And if our body can't handle those extra oxalates, one of the places it gets rid of them is in the urinary system. And oxalates like to bind with calcium. They form together to form calcium oxalate stones. And that's one of the more common types of kidney stone formation. There's also calcium metabolism problems. Calcium metabolism can be related to too much calcium intake. Particularly taking a lot of calcium supplements for osteoporosis and other things. Everything nowadays has calcium added to it, whether it's your orange juice or every other pill that you take has calcium added to it. So we get a lot of calcium in our diet. The aspects of calcium metabolism, it can be also at the level of the intestines, and people who have Crohn's disease, ulcerative colitis don't absorb and handle their calciums properly. And there again, the calcium oxalate like to merge together and form kidney stones. You can have calcium issues related to the kidney, and sometimes it's called renal tubular acidosis is a big word for it, or renal leak hypercalcinuria. It basically means the kidney does not hold on to calcium. It pumps a lot of calcium through. So in some ways, you actually deplete body stores of calcium, and where you get those body stores, or where your body tries to replace it, is by helping pull calcium out of bones. And so over time, if you have really bad calcium leak through the kidneys, you can lead to early osteoporosis and thinning of the bones. So stone disease can play a role in all that. Or it could be a parathyroid tumor is the other main factor. And they're not that common, but they're not uncommon either. And the parathyroid is a gland, there's actually 4 of them, usually 2 on each side of the thyroid up here in the neck, that regulate calcium metabolism in the body. And if you develop a tumor on one of those, it can produce too much of the hormone that regulates calcium, and it can cause calcium levels to rise significantly. No, not at all. Not at all. Sometimes we actually use calcium to treat calcium kidney stones. It sounds contrary, but it actually works. And really the only way to know is to do an evaluation. You have to have what's called a 24-hour urine. We always like to send the stones off and see what they're composed of, if we can get them. But we also like to send the urine, or do a 24-hour urine where you pee in a jug for 24 hours. It lets us see what the metabolism's putting out. And it'll tell us, is there too much oxalate? Is there too much calcium? If there is calcium, then we do some blood work in addition to it to look for the parathyroid tumors, look for high levels of calcium in the blood, and try to figure out, is it an intestinal problem, is it a kidney problem, or a parathyroid problem? If it is a kidney problem and the kidney just can't handle calcium, the more calcium that you put in, the more you're going to waste in the kidneys and more potential stone formation you have. So if a person has that renal leak hypercalcinuria or renal tubular acidosis, they are going to be much more likely to form kidney stones if they take calcium supplementation. So if a person has a history of stones, it's best to do the 24-hour urine to know before going on calcium supplementation. Now, calcium supplementation is one thing versus calcium in the diet, meaning with milk and dairy products, things like that. It's kind of a darned if you do, darned if you don't, if the body is not handling the calcium properly, because your body needs calcium to help maintain the bones. But at the same time, the more calcium that you put in, the more apt you are to form a kidney stone. So that's where vitamin D really comes into play. Vitamin D does help get the calcium into the body, in through the digestive system, into the bones where it's supposed to be. But some people cannot have too much calcium. So that's where we find out what is the problem before we go recommending. The different types of calcium supplementation, there's calcium carbonate and there's calcium citrate. Citracal is one of the brand names that's on the market, and Citracal is actually designed for kidney stones because it's a citrate combined with calcium, and the citrate is that chemical that's akin to vitamin C that helps prevent kidney stones. It's a wives' tale. Really doesn't have anything to do with it. Exactly. Certain parts of the country, it probably does have something to do with it. The predominant mineral here is going to be iron. Iron has really not much to do with it. It may not taste great, it may look bad on the clothes, but it really doesn't have that much to do with kidney stones. Some parts of the Southwest have high calcium levels in the water. I mean, literally some streams there are almost milky looking. There's so much calcium in the water, all the limestone and other things that the water flows through. But in the Southeast, that's not that big of an issue. If it helps you drink water, go right ahead, but it's not one of those things that's an absolute must. Just get the water in. And nowadays they make all kind of flavorings for water, whatever it takes to help get the water in. And really, soda is another big factor. So a lot of this stuff we're doing to ourselves. With our diets the way it is, we're doing it to ourselves. There are all kind of formulas for that, and really I don't think there's really one good one for it. Literally, if you go pee and your urine comes out yellow, you need to drink more water. The only time it probably should be dark to any degree is the first time you get up in the morning, because there again, you've gone for a while without much intake. It should be a little darker, but when you pee and it looks really deep yellow, yeah, you gotta have a lot more water. Yes, there are. Actually, the diuretics that I was mentioning can, for a subgroup of people, actually lead to kidney stones. So sometimes diuretics can actually cause kidney stones, whereas we use them to treat kidney stones at other times. There again, knowing what the metabolic abnormality is. Also, some headache medications. There's one, and I'm going to mind blank on the name of it right now, but there's Topamax is the medication that has a fairly high I won't say fairly high, but it has a risk of stone formation taking that medication. And there's particularly one HIV medication that also will lead to kidney stone formation. So yeah, there are some medications that aggravate that. Really, it comes down to water, water, water. That is by far the number one thing. Getting worked up. If there are kidney stones, getting that evaluation, finding out what's causing it, and taking the right steps, whether it is taking medication, whether it's adjusting diet. And I really haven't gone into the dietary aspects, but the oxalates, as I mentioned, the teas, colas, coffees, things like that. If a person just watches the amount of salt intake, doesn't overdo red meat intake, and watches the soda intake, the tea intake, the cola intake, the rest of it is really not that big of a deal unless a person is a vegetarian and eats lots of spinach. Spinach is very high in oxalates. A lot of the turnip greens and those type of greens are pretty high. We typically say lettuce is okay, don't overdo the cabbage, and green iceberg lettuce is okay, romaine lettuce is okay, but when you start getting into all the mesclun greens, the radicchios, and all the other types of greens, those become higher in oxalates. And so in small proportions, it's probably okay. In higher proportions, it becomes more of an issue. Spinach is probably one of the worst. It's probably one of the highest of oxalates, which it's good. It's good for you. But if you have an oxalate metabolism issue, then it can be a bad thing. Actually, it probably tells more. It tells more. I mean, typically the stone is either going to tell you, does it have uric acid in it or not? And there are some uric acid stones that have calcium in them also. A lot of that we can tell based on if we did an x-ray, because if we can see the stone relatively easily on x-ray, it's got calcium in it, because we cannot see uric acid very well on x-rays. Occasionally you can, but it's usually very faint. So if you can see a stone on x-ray, it's got calcium in it. If you can't see a stone on x-ray and somebody passes one, it's probably uric acid. Nowadays, everybody goes to a CT scan. CT scan is going to tell you a whole lot more information. It's going to be able to show you a stone, even if you can't see it on plain x-ray. If it's not calcified, the uric acid stones, other types of stones will show up on CT scan. So it's probably the most definitive way of diagnosing a kidney stone. It's across the board, totally across the board. And they can be, when we say kidney stones, it can be a stone even forming in the bladder, because bladder stones typically are more from urine backing up. Say if somebody has had a bladder tack as a female, or a big prostate as a male, and they're not emptying their bladder completely and they have a stagnant pond of urine in there, you can form stones in the bladder. And actually, I used to have a stone I wish I still had that would have been perfect to bring to this. It was probably about yay big, that was taken out of a bladder to see how big that they can get. So they can form anywhere in the urinary system. We see them in the prostate, we see them stuck in the urethra, we see them, all over the place. I've had them, the entire kidney is filled with stone. Matter of fact, I've got one coming up that's that way. Basically, the treatment options for kidney stones, we try to do the most minimally invasive thing first, which is lithotripsy, but it doesn't break all stones. Probably 85 to 90% of stones, it will break sufficiently. You have to be able to see it on x-ray to be able to blast it. So if it's one of those uric acid stones that you can't see, you can't blast it, because you have to be able to put the crosshairs on it to be able to line things up and focus the shock waves on it. And basically what it's like taking a magnifying glass out in the sun and getting it at just the right focal point that you can start a fire on a piece of paper. So you're taking that light beam and focusing it at that point that delivers a lot of energy. Well, you can do sound waves the same way and focusing it on one point that delivers a very high pressure wave at that point that's like hitting the stone with a little hammer about 4,000 times trying to break it into small pieces. So if you can see it, you can treat it. Problems with lithotripsy also is even if you break the stone, some stones will break very easily and literally powder and come out as dust. Other stones will just break, so you may take one big stone and break it into several smaller stones. Well, those smaller stones still have to come out. And passing those stones, some people can pass them, some people it's going to hurt a lot, and sometimes they get plugged in the tubes. And if they get plugged in the tubes, then we still have to go in and take it out. So it's not a perfect way of doing it. None of the treatment options are perfect, but if everything goes smoothly, it's a very good way of doing it because you're basically sedated on a table. It takes about 45 minutes, and then you go home. They're not cheap alternatives. That's the other option, is going up in through the urinary system, either through the P channel into the bladder, up to the stone with a scope, depending on where it is in the tube. And certainly the lower it is toward the bladder, the easier it is to treat. The higher in the tubes, it's more apt to potentially float back up into the kidney and making it more difficult to get to. And so when we get in there to the stone, we typically use a laser to break it up into smaller pieces and then pull those pieces out with a little basket. Sometimes when we do that, we end up having to put in a stent. We try to avoid it when possible, but sometimes you have to put in a stent. A stent's a little plastic tube that keeps the ureter open and allows the urine to drain through, because if you do a lot of manipulation up in there, it's going to swell. And if it swells, it can close off, which will back up urine just like an obstructing stone, and that can cause nausea, vomiting, pain, and all the same symptoms. And so sometimes we have to put those in. And those, when we're pulling out those stone fragments, they're like little shards of glass, for lack of better terms. They will cut and tear as they come down through the tubes, and so sometimes you can create a good bit of damage to those tubes. We try to get the stones as small as possible, but it's not always feasible. And so it can do damage to the tube as you're pulling it out. And so there again, we put in a stent to help protect things until it can heal, and then we go back and take the stent out later. And then another option, we don't go cutting kidneys open much anymore. That's pretty rare. That used to be the predominant way, cutting kidneys open. Doing it the old-fashioned way, where you have a big incision on your side and then literally go in and either open the drainage part of the kidney or the kidney itself and go pluck stones out. That's a very rare occurrence nowadays. More commonly is something called percutaneous nephrolithotomy. It's basically putting a little tube in through the back directly into the kidney and then dilating that up, putting in a piece of plastic almost like a large straw that goes directly into the kidney. And then we can put a scope through that straw into the kidney, go to where the stone is, and then use a laser, or a lot of times that's using what's called an ultrasonic device that vibrates almost like an ultrasonic toothbrush, just at a very high frequency, that breaks the stones into little pieces, and then the center of it is hollow and it can suck those little pieces up at the same time. So you're breaking it and sucking it out so that it's not just going all over the kidney. Yes. Oh yes. That's the reason a lot of people, if they pass a stone fairly easily, they can still hurt a week later because that tube is swollen, it's been cut, it's been damaged, and so the more stones that you pass over time, you're actually doing more cumulative damage to that urine tube that can lead to strictures, that can lead to kidney function issues, especially if you leave a kidney blocked too long. The kidney is a remarkable thing. It can be blocked, high-grade blockage, and recover with very little issue. But the longer it stays blocked, the more damage that you do. And if you have multiple times, over time it can affect the kidney function. They can shrink up and you can lose function, which when you're younger is not that big of a deal. Although there's data nowadays that says that it can increase the risk of heart disease and it can lead to other issues, particularly blood pressure and heart disease. But when you get older, and then if you develop diabetes, high blood pressure, cholesterol problems, you start throwing all these things together, get a little vascular disease, then it's a higher risk of ending up on dialysis later in life. And so that's the reason we're pretty aggressive at trying to get these stones out of the urine tubes and not leave them there very long. Certainly, it's better to let a stone pass on its own and let Ma Nature do her thing. By far, it's better than doing any type of treatment, but not all stones are going to be able to be passed. They're either too large, and it amazes me. Sometimes I've seen stones that look like large grapes that will pass. And then other people have a stone the size of a pinhead that can plug at the bladder and make them sick to the point that it can kill people, particularly if infection gets behind the stone and gets out into the bloodstream. So the size of the stone does not always equal its chance of passage. We always say 5 millimeters or less, we try to give it a chance to pass. More than 5 millimeters, we're probably going to go do some treatment to it. I think we pretty much hit all the big highlights. But just as I said at the beginning, water, water, water. My usual statement is act like a fish. Every time your mouth opens, water needs to go in.